Hello, I am Dr. Nour AlAmal, a specialist in cancer care. Today we are going to talk about an important question many women ask me. Why does breast cancer happen? And more importantly, can we do something to prevent it? To make things clear, I will explain it in two parts. First, the causes we cannot control. Then, the causes we can reduce or avoid through our choices. Part 1. Causes we cannot control. There are some things that increase the risk of breast cancer, but we have no control over them. They are part of how our bodies are made. First, being a woman. Most breast cancer cases affect women. That is just a fact seen in all studies. Second, age. As we grow older, the risk increases. Most cases happen after the age of 50. Third, family history. If your mother, sister or aunt had breast cancer, your risk might be slightly higher. But this does not mean you will get it. It just means you need to be more attentive. Fourth, the natural hormone cycle. Having your first period at a young age, or a late menopause, means your body was exposed to hormones for a longer time. This can slightly increase risk. These factors cannot be changed. But having a risk does not mean you will get the disease. What matters most is awareness and regular medical checkups. Part 2. Causes we can avoid now for the good news. Many risk factors are linked to how we live, and that means we can make a difference. Let us go through the main ones based on scientific studies. 1. Excess weight and obesity. Especially after menopause, body fat can play a role. Maintaining a healthy weight reduces your risk. 2. Lack of physical activity. Moving your body daily, even just walking, helps protect your overall health, including your breasts. 3. Alcohol. Even small amounts of alcohol increase the risk. Reducing or stopping alcohol is a powerful step for prevention. 4. Smoking. Tobacco is not just harmful to your lungs, it is also linked to a higher risk of breast cancer. Even secondhand smoke has effects. 5. Long-term use of birth control pills. Using them for many years might slightly increase the risk. This does not mean you should stop, but talk to your doctor if you have other risk factors. 6. Hormone therapy after menopause. Some women take hormone medications after menopause. It is best to use them carefully and under a doctor's supervision. 7. Unhealthy food choices. A diet high in fatty meats, processed food, and low in vegetables can weaken the body's defenses. Eating fresh fruits, vegetables, and reducing red meat is helpful. 8. Exposure to harmful chemicals. Some plastics, beauty products, and pesticides contain substances that may affect the body over time. Using natural or well-controlled products is a smart choice. 9. Chronic stress. And finally, stress. Long-term emotional stress can weaken your immune system and disturb your body's natural balance. It does not cause cancer directly, but it makes your body more vulnerable. Learning to breathe, relax, talk, and ask for help is also part of taking care of your health. Closing. So yes, we cannot control everything, but we can make real choices every day to protect our bodies and reduce risk. Healthy food, regular activity, avoiding tobacco and alcohol, and most importantly, listening to your body and staying informed. Thank you for watching. If you enjoyed this video, subscribe to the channel to get more helpful and hopeful information. And remember, awareness is the first step to prevention. As long as there is awareness, there is always hope.